Hello. Welcome. My name is Calliope, and I'm going to be performing your procedure today. Would you mind just confirming your name and date of birth for me? Excellent. Thank you. So, let's see. Alright. Are you in any current pain or have any current illness at all? Okay. So, you're having some issues with your right ear. Okay. Would you mind just telling me a little bit about that? Okay. You're having some irritation, some issues with hearing. Okay. And are you having these same issues with your other ear as well? Okay, nothing's going on with the left ear, just the right side. Okay. Alrighty, so just gonna ask a few questions before we begin. Have you had any changes to your medical history since we last saw you? Okay, and your family history? It's good to hear. And any allergies? Okay, and what about your medication list? Okay, excellent. Alrighty, so I'm gonna pop on a pair of gloves real quick, and then I will take a look at your ear. So for the examination portion, I will be having to touch you, of course. Do I have your permission to do that? Do I have your consent to touch you? Excellent. Alright, there we are. So firstly, I'm going to take a look at the outside of your right ear, okay? Just going to come over here and be palpating around a bit. Look at the preauricular area. Just pull your ear back. Look at the postauricular area behind the ear. Okay. Just taking a look at the outsides here. Okay. So everything seems to be pretty normal. Over here. Looks good. Nothing looks irritated or swollen. There's no cuts, no lesions. Okay, it's all looking pretty good. So, I'm going to grab an otoscope and we're going to take a look at the inside of your ear. Okay? Alrighty, so I'm just grabbing a sterile speculum here. Just going to check the light. All good there. Okay, so I'm going to be inserting the otoscope into the ear canal. I'm going to be looking at the ear canal itself, be looking at the tympanic membrane, see if there's any irritation, any swelling, any perforation of the eardrum, any sort of issues that might be going on, okay? Alright, so I'm just going to come over here and I'm just going to pull up and back on the ear, and then we're just going to insert the otoscope in the ear canal and just have a look around here. So it looks like you have quite a bit of cerumen buildup. Immediately I can see. Looks like there's some irritation as well in the ear canal itself. Nothing too crazy. No swelling. So I'm just going to take a look at the tympanic membrane. Okay. So it looks like that is intact. It's a pearly gray color. me just have a final look here. Looks like mostly we have an issue with the cerumen buildup. Okay, that's easy enough. So, alright, so it looks like really we just have a buildup of cerumen here. Cerumen is the medical term for earwax, and earwax is a natural substance that our body produces. It helps lubricate the ear canal, helps little bits from getting into the ear, has all sorts of beneficial properties, but when you get too much, then your ear can become clogged and irritated, and there's a couple different ways that this can happen. One of the biggest lately is due to a modern miracle called cotton buds or Q-tips. And people try to clean their ear canals with cotton buds, and this is a big no-no. Even the box says so. So when you put that cotton bud into your ear canal, then it just pushes back all your cerumen and you get a blockage. And another reason that it could be happening is some people just naturally produce a lot of cerumen. It's not that big of a deal. These people usually get their ears cleaned pretty regularly to make sure there isn't an issue. So I'm going to clean up the outside of your ear first, and I'm going to do that by getting a kabuki brush here and using the kabuki brush. I'm just going to be brushing the outsides of your ears, and this will help brush away any dirt or debris that naturally accumulates throughout the day. And after I'm done brushing your ear, then we will go in with an alcohol solution and just wipe everything off and get it ready for us to clean your ear, okay? Okay, so I'm just going to come over here and I'm just going to brush down your ear. We're going to brush in front of your ear, behind the ear, and the ear itself. There we go. So again, we're just doing this to just brush away any of the dry bits, any of the dust, any of the dirt, the debris. Just do this for a few more moments, and then we will wipe you off. Okay. Alright, so I'm going to get a bit of tissue here, and then our solution, and then I'm just going to wipe your ears off, okay? Ear, rather. It's a bit warm in here today, isn't it? It's supposed to be about 80 degrees, but humidity is still very much like regular summertime, right? I've got a little glass bottle, a little dropper. This has a little translucent substance, and this is the solution that we will clean your ears with. So I'm just going to be placing a couple of drops of the solution into your ear. Have you tip your head to the side so that it stays in your ear quite well, and then we'll leave that in for a little bit, and then we will have you tip your head over so that the solution can run out of your ears, and then afterwards I will take a little look, assess your hearing just a little bit, and if all goes well, we'll send you on your way, okay? Alright, I'm just going to come over here. I'll have you tip your head to the side. Going to take the dropper and put it on the inside of your ear and just drop that in. So your ear might feel a little full while the solution is inside of the ear, okay? We're just going to leave it here for a little bit while it works on breaking down some of that cerumen, and then we'll have you tip your head over so that we can let that solution run out, okay? Okay, so I'm going to get that tissue. I'm just going to be placing this on your ear, and I want you to just tip your head over so that we can let the solution run out of the ear, okay? So just tip your head over, let the solution run out. I'm going to take another look with the otoscope to just make sure that everything got cleaned out. Okay. Alright. So I'm just going to pull up and back on the ear. Insert the otoscope. Okay, that looks much better. Okay. Alright, it looks like we've got mostly everything. There's just a little bit left, but that's okay. You don't want to get rid of everything. It's there for a reason. So, okay, that looks good. I'm going to pull the otoscope out. Alright. Okay. How do you feel? Good. How do you think your hearing is? A little bit better? I'm going to come to the side and I'm just going to whisper a few numbers in your ear, okay? Just want you to repeat those back to me. Right, ready? 17, 63, 92. Okay, heard those okay? Alright, that sounds great. So, let's go ahead and get you cleaned up then. Clean up any of the solution that might still be on the ear. And then after we give you a clean up, we can send you on your way. questions or concerns for me? Anything else I can do for you? Okay, wonderful. Just going to take my gloves off here. So, you are free to go, and if you have any further trouble at all, please call the office and we will get you in as soon as we can, okay? If there's any issues, any problems, alright? Okay, so thank you so much for coming into the clinic today. Thank you for letting us help you, okay? Alright. I hope you have a whale of a day. And I hope you have a good rest of your night, okay? Okay. Thank you. Goodbye now.
Thank you so much for watching. I really hope you enjoyed this video. Please like this video if you want to. Comment if you'd like to. Subscribe if you want to see more from me. And if you want to catch me on some socials, my Twitter is at Calliope Whisper with no S. My Instagram is at XX_Calliope. I'd like to give you a special thank you to my patrons on Patreon, for whom this wouldn't be possible, as well as the support